Good afternoon, everyone. Thank you for joining us. My name is Jennifer Strohecker. I serve as the State Medicaid Director and the Director of the Division for Integrated Healthcare. The vision behind hosting these virtual meetings is to give our agency the opportunity to connect and collaborate with those directly impacted by the Medicaid and CHIP programs. This is an opportunity to voice your concerns and your current experiences and give us feedback so that we can better serve Utah. We will have an FAQ portion of the meeting in just a bit, where we have collected questions prior to the call, and we will be going through those questions in the later portion. Closed captions are available for those who would like to use them. Please click Show Captions in the menu at the bottom of the screen. You can also choose to listen to this meeting in Spanish or can watch an American Sign Language interpreter if that is your preference. Click the globe interpretation option in the menu below to select either of these options. This meeting is being recorded and will be posted on our website. If you would like to watch it at a later time, you can find it at https://medicaid.utah.gov/meet-the-Medicaid-director / and we will put this link into the chat. To start, I'm going to go over current activities in the division and upcoming policy changes that are likely of interest to you. So the first item I'd like to cover is our Medicaid unwinding update. I will then be moving to some upcoming program changes that are occurring in January, and last, touch on our dental coverage legislation. You could move to the next slide. At the beginning of the COVID-19 pandemic, the federal government declared a public health emergency, or PHE. During the PHE, state Medicaid programs were required to continue Medicaid coverage for all members, even if their eligibility changed. As a result, Utah Medicaid members stayed covered during the PHE, so they didn't have to worry about their health coverage during this challenging time. On March 1st, 2023, the Department of Workforce Services, or DWS, began to review all Medicaid cases over the next 12-month unwinding period. This is being referred to as unwinding. So this period of reviewing all cases over the next 12 months. Each member in the Medicaid program will have to be reviewed over this 12-month period. Members have been assigned a review month, and their case has stayed open until their scheduled review month. Members are encouraged to continue using their medical benefits as normal until DWS completes their review. Now, many people moved during the pandemic, so it's critical that we are able to reach members when it is time to review their eligibility. Utah Medicaid is asking members to keep your contact information current. This is important so that if you have moved during the pandemic, or if any of your contact information, like your phone number or your email address, has changed, we need to have this information so that we can reach you. If you would, please call your health plan that you are assigned to update that information. You can also call DWS at 1-866-435-7414, or you can update your address on My Case at the hyperlink that is included in the chat. Another alternative is that you could call one of our health program representatives who would be happy to help you. Their phone number is 1-866-608-9422. And this information has been updated in the chat. The second thing we want you to do is watch for letters from DWS. Members need to pay close attention to your mail or even your email for notices that may come from DWS talking about your eligibility review and any information that is needed. We need you to respond timely to these reviews. You can also go into My Case to our online portal to see what your review date will be. The third step we'd like you to do is to complete your review. So all medical programs are renewed each year. In your assigned review month, DWS will try to complete your review with the information that they have. If DWS does not have enough information, you will be asked to complete your review. This will be, of course, sent in your mail, via mail or email. We need you to return your completed review as soon as possible to avoid losing your Medicaid coverage. You can lose your Medicaid benefits if you don't return your forms or if you miss deadlines. So it's very important that you respond to these notices when they arrive. So a next important piece is, what options do you have if you have lost your Medicaid coverage? If you have lost coverage because you didn't return your review form, you may still be within the 90-day reconsideration period where your coverage can be restored. Please send back the review form or other information that DWS needs right away. People who are no longer eligible for Medicaid will be automatically transferred to the Federal Health Insurance Marketplace or healthcare.gov. There is currently an automatic process that happens where this transfer will take place as long as a determination of coverage is made. The transfer will not happen if you lose Medicaid coverage because you do not complete or return your paperwork. So again, it's very important that you do complete and return your paperwork. People who do not qualify for Medicaid can also get coverage through the Federal Health Insurance Marketplace. Most people qualify for savings on a health plan to lower their monthly premiums and copays. You can get this information at healthcare.gov, and we will put that information in the chat. Now, people who lose Medicaid do have 60 days to apply for health insurance on the federal marketplace. You'll have to wait until the next open enrollment period if you don't sign up for a new health insurance plan within 60 days of when your Medicaid benefit ends. So we're encouraging you to act now if you are no longer eligible for Medicaid. If you would like more information on any of the resources that we've talked about with unwinding, you can visit our unwinding webpage at https://medicaid.utah.gov/unwinding, and it's listed here on the screen. The next item I'd like to update you on are some program changes that are occurring in January. We're really excited about the upcoming changes that are happening in our Medicaid and CHIP programs. And the first program I'd like to highlight is our new CHIP program that is coming in January. During the 2023 legislative session, SB 217, named Children's Health Coverage Amendments, authorized the department to create a new category of eligibility for our Children's Health Insurance Program called State CHIP. Children who may be eligible have working parents and meet the following criteria. First is a non-U.S. citizen who is not a lawfully permanent resident holding an LPR or green card. You also have to be under the age of 19. You have to meet income guidelines of 200% of the federal poverty limit. You are not currently covered by other health insurance. You're not eligible for Medicaid or other CHIP benefits. And prior to the date of application, you have been residing in Utah for at least 180 days. State CHIP will open enrollment on January 1st, 2024. This is a 3-year pilot program that has a limited budget of $4.5 million. With the available funding, we estimate the program will be able to cover up to 2,000 children. Once enrollment has closed, applications will not be accepted until the next open enrollment period. We are so excited for this new population to have access to low cost and comprehensive coverage. More information is available on our website at chip.utah.gov/state-chip. That information is also in the chat, and many resources are available on that site. The next update I'd like to share is a change to our non-traditional Medicaid benefit. On January 1st, 2024, there will be changes to Utah Medicaid's non-traditional benefits. Now, the non-traditional benefit plan with this change will have the same benefits as the traditional benefit plan. So we are actually seeing a broadening of coverage. This was directed by CMS, or the Centers for Medicare and Medicaid Services, in order to eliminate the disparity between the two plans. This will affect the following Medicaid programs. First is Parents on Adult Expansion Medicaid, or Parent Caretaker Relative Medicaid, 12-month Transitional Medicaid, 4-month Transitional Medicaid, and the Family Medically Needy program that has a spend down. The changes that are happening are very exciting, and these will cover the following services. First, this program will now cover non-emergency medical transportation. This will provide transportation to and from medical appointments and other medical services that are covered by Medicaid. Members can go to My Benefits to see if they are eligible for a UTA transit card. This information is contained in the chat. If you are eligible, you can begin using your UTA card after January 1st. Another benefit change is eligibility for our early and periodic screening, diagnostic, and treatment, or EPSDT services for 19 and 20-year-old members. This broadens our benefit coverage for individuals who meet EPSDT criteria. There's also an expansion of physical therapy and occupational therapy, so there are more visits that can be covered under this benefit. It also covers speech services and audiology services, medical supplies and medical equipment, and long-term care services. Details about these changes will be mailed to members and posted on our website as we get closer to that implementation date in the new year. Another exciting benefit change we'd like to share is our coverage of 12 months postpartum coverage for women. These result from Senate Bill 133 from our last legislative session, and this title of this bill is Modifications to Medicaid Coverage. This legislation extends postpartum coverage from 6 weeks to 12 months for pregnant individuals, and provides continuous eligibility during that period. So you get a nice extension of benefit. Medicaid plays a critical role in ensuring access to care for pregnant and postpartum individuals. So the postpartum care encompasses a range of important health needs. It includes recovery from childbirth, follow-up on pregnancy complications, management of chronic health conditions such as depression, diabetes, and hypertension, access to family planning, and addressing mental health conditions. At least 1/3 of maternal deaths occur in the postpartum period. So we are thrilled to be able to provide this support and resource for new mothers. This coverage will go into effect on January 1st, 2024. The last item I'd like to cover is dental legislation that came through in our past legislative session. This legislation expanded dental benefits for adults enrolled in Medicaid. In order for this coverage, we had to submit a waiver to CMS for approval. It was submitted on July 27th. We have not heard back from CMS on a decision of this waiver yet. But once we receive approval, until we receive approval, we don't have an implementation date. But essentially, the state requested to eliminate the dental benefit specific to blind and disabled, aged, or TAM groups, and create a dental benefit that can be accessed by adults 21 years in age and older, as defined in Section 2. This will allow individuals aged 18, 19, or 20 to receive their dental benefits under the EPSDT benefit. With this amendment, TAM individuals will no longer need to be enrolled in a substance use disorder treatment program in order to receive dental benefits. The projected enrollment for individuals in this demonstration population is more than 240,000 individuals. More details about the proposal is available in the amendment request on our website. Now, my last update is an opportunity for you to get involved, and we need your voice to improve our services. We wanted to make you aware of the Medical Care Advisory Council that meets once a month and is an opportunity for members to join this Medical Care Advisory Council committee and weigh in on important issues and updates. We're going to put the website link for this meeting into the chat, where you can see more information about the Medical Care Advisory Committee and also the resources that are available. Another opportunity is that we do have a Medicaid and CHIP eligibility notice improvement project. So the notices you get in the mail and the letters that come from DWS or the Medicaid and program, we have a committee that involves Medicaid members. And really, it's important for us to have your voice and your input so we can improve the notices that you may receive from the Medicaid and CHIP programs. We'd invite you to get involved in this. More information will be posted on the MAC website, in the Medical Care Advisory Committee website, in the very near future. But if you are interested in being involved, we are going to put an email into the chat at medicaidmemberfeedback@utah.gov where you can get involved. So with all that being said, I want to turn the time over to you. Please know that I cannot answer all questions about your specific eligibility or case, but I do want to hear your program questions and feedback from your interactions with Medicaid. Please use the chat feature below to submit your questions to DHHS Communications. We will answer these as they come in. Additionally, many questions were submitted in advance of this meeting, so we thank you for doing that. And we'd like to take the opportunity now to be able to respond to some of these questions for you. I have invited several members of my team to join our call at this time to help support the responses to your questions. Okay, so the first question that we received was a question stating, I want to reapply for Medicaid. Will that be, yes, and you wanted to see what we'll be talking about. And so what we've done is we've actually provided you several different ways that you are able to respond, that you're able to reapply for Medicaid. You can do this first by logging into My Case and going into that and submit an application directly through that electronic portal. So we will put the My Case link into the chat now. There's also an opportunity to do this by mail. You can download a Medicaid application, and you can find the application at medicaid.utah.gov/apply Medicaid. And we'll also include that information in the chat. There's other information about being able to apply by fax, where you can fax an application through a toll-free fax number at 1-888-522-9505, or you can come to a DWS office where you can fill out an application in person. And so if you were to put a site, we can actually put a link into the chat that will allow you to put in your zip code, and you can find an office that is near you to be able to do this. The next question that we received was, will I qualify in 2024? What are the guidelines to qualify? So first of all, we'd like to refer you to our online resource at jobs.utah.gov, where we have a comprehensive list of all the guidelines. But underneath the guidelines, you can see apply for assistance or under learn more. This will give you information around our income limits and asset guidelines that we use to verify your Medicaid eligibility. These will be updated as requirements change in 2024. You may also submit an application at the same web address. Okay, the next question we have is, when will the income limits be raised to match the cost of living increases that we see? I would hope in the future that CHIP or a program similar can be available for all children, so families won't have to put off doctor's appointments because of no insurance coverage. And certainly, we agree that we would love to have all children covered by some insurance so that they had access to doctor's appointments. But to respond specifically to that questions, income limits are adjusted each year in March. And so you will see some changes on income limits that will be updated in March. The other piece that I didn't cover in my updates, but I wanted to note with regard to coverage for children and around keeping kids covered, is that also effective in January, is that children on the Medicaid program will be eligible for 12 months continuous coverage. So this is one exciting change, is that when a child does become eligible, they are automatically eligible for 12 months in both our Medicaid and our CHIP programs. Okay, the next question that we received is quite extensive, and we would really like to hear from you personally. It is regarding an individual who submitted a question around their disability and some of the challenges you're having to pay your bills. This is a single mother, and this mother applied for Medicaid because they needed a new prosthetic leg and knew there was no other way to afford it. They were hoping between Medicare and Medicaid that the prosthetic would fit right and improve daily functions. And the conversation is around spend down and income and some of the challenges that you have faced with your disability and getting coverage under our programs. We would love to help you specifically. It's challenging for us to evaluate your specific case without specific information. We would love to work with you. We will reach out to you for more information to help answer this question. But if you would also like to reach out to us at the Medicaid program, you can please do so by calling the Medicaid Constituent Services at 877-291-5583. You could also contact the Department of Workforce Services at 877-435-7414 to go over your case. If you feel that your decision is incorrect, there is an opportunity for you to file for a fair hearing to have that decision reevaluated. We're going to put the phone number for this information into the chat so that you have this resource, and we would like to help support you and work through your situation. The next question we received was, do I need my fiance's pay stubs again? Again, this is a very personal question. We have a difficult time answering your specific question without knowing your case. If we would like to actually reach out to you for more information to help with this question, there's also an opportunity, like we said, for you to reach out with DWS. We have the information we put into the chat for you to be able to reach out to them to go over your case. And you can also see what is needed in order to have your eligibility reviewed and which pay stubs you need by going to our My Case link that is also in the chat. The next question we received Medicaid covers the cost of my Medicare and drug coverage through Humana. How will my Medicare work when I no longer have Healthy You Medicaid and Humana drug plan? I'm concerned and confused because I also have a primary plan with Blue Cross Blue Shield through my husband's employer. So if you do lose your Medicaid coverage, Blue Cross Blue Shield will remain as your primary insurance. You would be responsible to pay the premiums to keep Medicare as your secondary coverage. If this response does not quite answer your question, we have put our information into the chat, both for DWS as well as our constituent services number. We'd be happy to help you directly. If you'd like to reach out to us, we'd be happy to do that to help you out. Okay, the next question is a similar question as to how to apply for coverage. But I'll specifically say that the question that we received was, my daughter turns 19 in December, and she is currently not employed. She does have coverage with Blue Cross Blue Shield, which is a very high deductible. Will she still be covered under Medicaid? So our response is that if your daughter is still covered by Medicaid when she turns 19, DWS will automatically redetermine the eligibility for any available Medicaid program. If additional information is needed, a notice will be sent either in the mail or via email. And so we would need you to respond to the information that was requested in that notice. If you do lose coverage before 19, we'd ask that you reapply for Medicaid with those various ways that we had outlined, that I had outlined earlier. You can do this through My Case by downloading a Medicaid application and submitting it via mail. You can submit it via fax or in person at a DWS office. Now, there is another question that came in that asks a complex question that says, does getting care give compensation through DSPD count as income for eligibility purposes? We need to help you specifically with this question, and we would love for you to be able to reach out to us. We would like to reach out to you, but we would also like to be able to work with you personally. If you could please contact us through constituent services, we would like to personally work through your question with you to look at care compensation and how that works through DSPD and income for eligibility purposes. Okay, the next question was, who can we contact to find out if we qualify for Medicaid and Medicare? So for Medicaid, please visit our jobs.utah.gov. We also have our phone number for DWS for you to be able to reach out and see if you are eligible for Medicaid. For Medicare, you do need to call the federal government. So you can visit an email site at ssa.gov, or you can call 800-772-1213 to get that number. So again, that's 800-772-1213. If you need help applying for either Medicaid or Medicare, we're going to direct you to a website, which we will put into the chat. But we also have a phone number if you need assistance, and that phone number is 800-541-7735. Okay, I'd like to respond to the next question, which says, we are legal guardians of our grandson who turns 18 in December. We are submitting for power of attorney and medical directive as he goes into adult status. What do I need to do for his Medicaid to continue? And is there a new application we need to fill out or submit for a Medicaid directive under Medicaid? Thank you. So our response is that turning 18 should not affect whether or not your grandson maintains coverage. Upon turning 19, you will want to make sure to submit the power of attorney or medical directives to DWS if you want to continue to assist him in maintaining his coverage. The next question we received was, do I still have Medicaid? We'd love to help you. One of the ways we need to know is by looking up your case-specific information. And so please contact us. We would love to help you know if you have Medicaid or not. So you can do this a couple of ways. You can contact DWS at this who can help you with details of your case. You can go online at jobs.utah.gov/mycase and look up your specific case information. We'd be happy to help you if you could please outreach and contact us. The next question was a Medicare question. When should we be moving children from Medicaid to Medicare? They are now adults, 25, and what is the process? And our guidance on understanding Medicare is to go to Medicare's website, which we have put into the chat, which is ssa.gov. Or by calling 800-772-121-3. Okay, the next question we have, and I'm sorry we have so many questions and we really appreciate you sending these in, is how is Medicaid linked to Marketplace? So first, Marketplace is for individuals who are not eligible for Medicaid. So in order to learn more about Marketplace, you could visit healthcare.gov for more information on that to your question. So the next question is another one of those personal questions that we did receive. This question is specific to an individual who has to pay for their therapy. Their therapy is vital because the whole reason I'm on disability is because of a mental illness. But because I worked so hard before I was put on disability and because of reasons I never understood, and I'm thankful for, my disability is higher than most. In my home state of North Carolina, I qualified for Medicaid because I am on disability. But now they're here in Utah over the limit. So if this is you, we need more information in order to help you. We recognize you have enormous responsibilities on your plate from the things that you've shared with us in the information. And we will reach out to you to provide some support. You can also reach out to us. We've placed our phone number into the chat where we can assist you through constituent services, or you can feel free to call the Department of Workforce Services as well. The next question is another question that we did receive. We do need a little bit more information. This one is a question that was submitted that says, my ex-wife resides in Las Vegas, Nevada. You share a young daughter. You have full custody of her and who lives here in Utah. You care fully for your child, and she resides in your home. And there are several questions that go on below this. I want to thank you, first of all, for submitting your question. We do want to have some additional dialogue with you so that we can help to make sure that we are providing you the best information. We will reach out to you for more information to help you with this request. And we do want to just state that Medicaid is dependent on the state the individual is a resident of. So I just want you to know that. If you want to contact Nevada Medicaid, the phone number is 775-684-1100 to verify enrollment. However, we'd be happy to help you. So we will reach out to you for additional support. So the next question we got was about citizenship status. Does illegal immigration affect Utah Medicaid? And if so, by how much? So first, we want to touch on this question based on the earlier presentation I gave, which talked about our state CHIP benefit. So residents who do not meet citizenship requirements are only eligible currently for emergency services or emergency Medicaid program. But beginning on January 1st, 2024, children may be eligible for our new state CHIP plan. So we have been included our state CHIP link into the chat. We'd encourage you to look there for more information. The next question we got was, how come every year when Social Security provides a cost of living or inflation increase, Medicaid always adds the amount of the increase to my spend down? Because of this, I will never benefit from the increases that are meant to help Social Security recipients. And to make it worse, I got my CHIP benefits taken away this year because the increases back in January made me ineligible for having too much income. So it seems really challenging and unethical and not understanding. So we want to just state that we'd like to help answer any additional questions you have, but our response right now is that Social Security income increases in January, and the Medicaid income limit doesn't increase until March. So there is a little bit of a 2-month separation there as to when those increases occur. Income limits are updated every March and can be found in our Medicaid resources, which we can share with you. If you would like additional support or questions, we would encourage you to reach out to Medicaid Constituent Services so that we can support you with your questions. We will also put resources into our Medicaid policy manual into the chat for your review. So the next question is a question again around income. I was wondering why you don't go off of what people bring home instead of before taxes. It hurts families, or like me as a single mom who can't be offered health insurance and depend on what my mental health, because I'm getting kicked off because I make $34 too much. And if I get cut back on hours at work, then I'm hurting myself in the long run. So thank you for submitting this question. And while we completely understand and sympathize with your situation, the federal regulations do require that states follow certain income requirements regarding our Medicaid eligibility. This does include counting income before deductions are taken out. Changing or increasing these requirements as we have them set as a state would have to be a decision that our Utah legislature would make. And so that is sort of the pathway we would have to make adjustments on this. But if you have more questions or would like to ask for additional help, we'd be happy to support that. The next question we got is, I wasn't aware of my Medicaid eligibility being available to me, and I don't have insurance at my job. But I was informed that I was covered under Medicaid today at my doctor's appointment. Do I owe anything for my Medicaid coverage? And I'll just say this is another challenging question to be able to answer for you if we don't have your specific case information. We would like to reach out to you to get more information and help you answer your question. If you would like to call us, you can do that by calling DWS at the information that we have listed. You could also visit the online portal to be able to look up your specific information under My Case. And again, this information has been put into the chat. I'm going to switch directions just quickly here and get off of eligibility and ask about a coverage question regarding medications. So a question that had been submitted was, why are compounded medications not covered? And we actually do cover compounded medications. These are a benefit of our Medicaid program. If your pharmacy is saying that we don't cover it, we'd love to be able to work with your pharmacy to evaluate why your compounded medicine isn't getting covered, and we would love to support you. And so we just wanted to make it clear that compounded medicines are covered. Again, if you have questions, work with your pharmacy, or we'd be happy to help support you if you'd like to reach out to us. The next question is, we have guardianship of our granddaughter who is on Medicaid. She will be 18 years old and attending college in the fall of 2024. Will she still be covered by Medicaid? So again, this is without specific information. It's challenging for us to reach you directly and give you a response to this. We will reach out to you for more information to help answer this question, or you can reach out to either DWS with their phone number or through My Case, where you can ask some questions there. There was a question that was submitted around a new matrix of household income versus the number of children for Medicaid and CHIP qualification standards. Would we share that with you? Certainly we would. We would be happy to share our current income limits. They are found within our policy manual in Table 7. As we mentioned earlier, these limits are updated every March, and we will include the hyperlink to the table in our policy manual into the chat. So there was a question again where we really do need your specific case information, but I wanted to let you know we've seen your question and we want to help you. The question that was submitted says, have my benefits changed this year? Will I get extra help with my policy? Will my drugs be covered? Is there any way I can get in-home help with cooking meals and personal care? So again, we'd love to reach out to you to help you with these questions. We do need more specific information. You could also reach out to DWS or look online for that. Again, if you would like more specific questions, please feel free to call our Medicaid Health Program representatives at 866-608-9422. There was a question that said, what is the difference between Medicaid and CHIP? Can my child have CHIP if we also have other insurance, but the other insurance doesn't cover everything? What are the qualifications for CHIP? So we'll attempt to respond to your question. So first of all, Medicaid provides comprehensive health coverage, including low-income adults, children, pregnant women, elderly adults, and people with disabilities. CHIP, as an alternative, or the Children's Health Insurance Program, is a state health insurance plan for uninsured Utah children and teens. So CHIP is available for children who do not have other insurance. So you see that the coverage for Medicaid is more broad, certainly has different income standards. The CHIP program is a specific program designed for Utah kids and teens that do not have other insurance. What do you do when you make too much money, but after household bills, you have no money for Medicaid, medications, or food? We would encourage you to call 211 or seek 211.utah.gov, which we'll put into the chat, where you can get some assistance with these other things that you're talking about regarding food and things. So thank you for that question. So there was a question submitted that said, I had Medicaid, then I was switched to the cost sharing program. Am I still on Medicaid? We'd like to help you without specific information. This is really hard to answer. So we will reach out to you for more information to help you with this question. Likewise, you can reach out to us at DWS or through my case to be able to get support for your question. So the next question, again, is more personal, and we do need some information from you so we can support you personally. This question was submitted and said, I don't know if I have Medicaid as I'm reapplying with all the documentation. I have a surgery scheduled for a right knee replacement. What happens if I miss the deadline? So again, a personal case information, we need your personal case information so that we can provide you with the answers to your request. So again, we'll reach out to you, but you could also submit your request to DWS or go to my case. The next question was a question from a member that says, I don't have my review until April of 2024. Do I still need to submit any paperwork for 2023 at my review or at the end of the fiscal year? So the worker must attempt, and the DWS employee must attempt an ex parte review that doesn't require anything on your part as the first start, okay? And if we're able to complete your review you could just be automatically approved for Medicaid without having any work on that you have to submit. But if the DWS worker is unable to complete your review through that ex parte process, a pre-populated form will be sent to you in the mail or via email when your review is due. After you return your review form that's been sent to you, DWS will inform you if you need any additional information to be submitted. Okay, the next question is about a child, a parent who's had a child with disabilities, who's been on Medicaid for several years. And in 2023, we were instructed by Social Security that the child needed to sign up for Medicare. They did. Now they get information from Health Choice Utah. It appears he has 2 health insurance plan, which is primary. Why 2 plans? They pay a spend down every month. Is this necessary? I was told if he receives other Medicaid benefits other than medical, he has to pay the spend down. Please explain and confirm. So there are a few things we can help you with, and perhaps more information is necessary. But first, when you have Medicare and Medicaid, Medicare is the primary insurance. And then Medicaid or Health Choice is the secondary insurance. We would love to assist you, and we would encourage you to contact DWS at the 877-435-7414 or a Medicaid program representative at 866-608-9422 to provide personal assistance about your case. Thank you. Okay. The next question is, again, one that requires more specific case information, but I wanted to acknowledge that we had received this question submitted that says, my granddaughter currently has Medicaid through her father, and that this father is transitioning out of IOP in January and getting his own insurance. But my granddaughter is going to a provider who only accepts Medicaid. This granddaughter has an 18th birthday in December. Can she apply for Medicaid on her own? Thank you for submitting this question. We do want to help you, so we will reach out to you to provide support. And if we could have your information, we will reach out to you in the chat. Thank you. So the next question is this. I am disabled, and I have been since September of 2012, when a ruling was declared in your favor. I, not knowing really what would happen then, started to receive Medicaid. My wife had started receiving Medicaid a couple years earlier as medically disabled. At that time, we made to make a spend down payment, which was very little but has increased over the years. Then we were put on a work incentive program, and my payments went up more and continued until June of 2022, when my job ended and I was terminated. So this is a pretty specific question around having to pay the payment, a payment. So I'd like to just say that we sympathize with your situation, and the program rules, unfortunately, around these payments did not change during the public health emergency. Spend down payments were still required. That being said, we did not allow a person to close if they made their payments once and subsequently did not make their payments. So we would love to be able to assist you. If you have any questions, please submit them to us. But we wanted to make sure you had this information. The next question has to do with closure that occurred to an individual who has a serious seizure condition and had their Medicaid canceled. We need your personal information so that we can reach out and provide support to you. So we would like to be able to reach out to help you get more specific information to your question. We can reach out to you, or if you would like to contact us, you can certainly do so through the information that we provided earlier, either through DWS or by calling one of our health program representatives. Okay, we have a few questions that I'd like to answer around coverage. I'm going to hop around here for the next because I know our time is running short. I do want to provide assurances that while we know we had received a number of questions from you, that we want to ensure you do get a response. We will be placing responses to these questions on our website after the close of this call, so you are able to see them. But let me go through a few more here while I've been able to look at this. Hello, I am looking for a new medical transit bus pass. My backpack was stolen and it was inside of it. How do I order a replacement one? We'll put the My Benefits link under here where you can request a replacement for your UTA transit card. You could also call a health program representative, and that number is 844-238-3091 to request a new card. Another question we asked was, we used to be able to claim reimbursement for gas used for transportation to medical care. Is that still available? And how do we access it since there are no longer, these are no longer sent by request? Is this still available, or where or how do I get this reimbursement request? So our response is that Medicaid members may receive 18 cents per mile or up to $300 per month per household for medically necessary services. The maximum may only be exceeded if the individual requesting reimbursement has a medical condition that requires frequent travel for treatment. So if this is the case, a DWS eligibility worker must sign off in the eligibility system and leave a documented note stating why the maximum amount has been. So that needs to go into your note, your chart note. The reimbursement request may be sent to your DWS caseworker, and the funds will be added to your pre-existing EBT card. Someone has asked for a replacement Medicaid card. We will include that in the chat, the phone number, but we also want to share with you that phone number is 866-435-7414 if you have lost your card. There was another question around someone losing their UTA card, and so same number that we've given previously around how you could request a new UTA card. Okay, next question is a pharmacy-related question. When exactly will Medicaid start to cover esketamine nasal spray treatments from the University of Utah? My wife is in need of this treatment. Our response is that this drug is covered by Medicaid pharmacy. It requires a prior authorization, which can be completed by your provider, but it is a covered drug, so we do cover esketamine nasal spray treatments. The next question is also a pharmacy question. How can someone appeal a decision on a medication Medicaid won't pay for that a person needs? The medication that Medicaid pays for does not work on that individual. So we would ask you to submit a request to us. And this is done through your provider or your doctor who is prescribing the medicine. They can put in a prior authorization request for a non-covered medication through this prior auth process. These are reviewed on an individual basis on the grounds of medical necessity, and we'd be able to determine that needs to be covered because the regular covered things don't work. Here's a question about braces. Why are braces not covered for children, specifically for special cases for kids who need them really bad and cannot afford them? And here's our response. Orthodontic care is a covered benefit for EPSDT eligible individuals, so those that are up to the age of 21 years of age. However, the member must meet the medical necessity criteria. So the doctor has to submit, or the dentist or orthodontist needs to submit information to Medicaid that would show that having braces is medically necessary. If your orthodontist would work with Medicaid prior authorization staff, we could determine if the member meets this coverage criteria. The next question is about chiropractic care. Why is chiropractic care not covered as preventative care for adults? So, actually, some chiropractic services is available. According to the information located in our physician services manual, chiropractic services is available to a limited number of services. We can actually send this information on what level of chiropractic services is available.
Podemos mandar esa información hasta qué nivel de servicios de quiropráctica son cubiertos.
Evaluate this and look at how chiropractic services could be covered. Okay, the next question is says specifically, I have received many communications by letters, emails, texts, and phone calls stating I should have received a PAP test and wellness checkup and receive rewards by completing them. But all providers have stated that these are not covered by Medicaid. I cannot take the chance of them not being covered. This has been going on for years, and I am very frustrated. What is the answer, and why does it seem that there's little to no communication between providers and Medicaid? So first of all, we one of our manuals, the Physician Services Manual, does cover the information that you are asking about. It contains information regarding coverage of wellness visits that can be covered up to one visit each year over the age of 21. For children, you can have, and these services are covered. There are specific services that are also covered for EPSDT, or children who are up to the age of 21. And these information would include all the well child visits and all of the things that are included in our member guide. So we will include that information. We're sorry that there's been confusion with your providers and what Medicaid covers. But even just this past year, we did start covering well visits for adults, for adult populations. So with that, I see there's a number of questions that have still come in, and we're very sorry we haven't been able to get to all of these questions. We so appreciate your time and the different number of questions you submitted to us. We do want to ensure that you receive resolution to your questions, that you understand, and we're able to help and support you with this. We will be posting responses to the questions that you have submitted to our website within the next few days. As we've drafted many different responses, we want to make sure you'd be available to be able to see what those are. Additionally, for those specific questions where we do need more information, we will need to be able to reach out to you specifically to be able to respond to that question. With that, I want to thank you for our time today and for your participation with us. We really appreciate your attendance, your ability to come on and have this time to spend with you. We do want to help you and support you. Please use the resources that were put into the chat to be able to connect with us. And we look forward to hearing from you in a future meeting. Thank you very much, and I hope you have a good day.